High blood sugar can lead to a coma. Low blood sugar, dementia, and both can cause death. Those are some of the first things I was told by members of the healthcare team when I was diagnosed with type 1 diabetes. I was a 38-year-old adult. I have a degree in medicine, but my diagnosis, still a shock. And advice like that, not what I needed to hear when facing an incurable chronic disease. I'm a family physician who's been treating patients for the last 2 decades. And now, for the last 5 years, I've also been living as a chronic disease patient. Although I've been part of the US healthcare system for most of my adult life, learning to live with my own disease has changed my perspective on the system. I have seen firsthand the true power the individual has rather than the system. So I ask you, who's faced a problem in healthcare? Access issues? Insurance denials? Same. The reality of our system is that it is flawed. But rather than this realization lead to persistent frustration and despair, I had a choice to make. I was now the patient, something I will be for the rest of my life, something most of us will face at some point in our lives. Leaning into the broken system, that was my game changer. To navigate in the current healthcare climate, and more importantly, to manage my health successfully throughout my life, it was important that I realized a few things that helped me achieve my goals. To start, I made a conscious choice to shift my mindset to seeing the tools that were available. I could be frustrated that my life depends on daily injections of a medication. Or I could see the amazing power of modern medicine. Before insulin, as a woman with type 1 diabetes, I wouldn't even be alive today. I realized I had a wonderful tool in the form of my insulin. Other wonders of my diagnosis timing, the exponential growth in the tech industry. It's made things like continuous glucose monitors readily available, and insulin pumps, a new way of life to infuse that insulin rather than have to carry pens and needles for multiple daily injections. I started to see that US healthcare had many tools. Now, not all tools are available to all. So here's the second thing that helped me lean in. Although I could only get what insurance companies authorized, and not all supplies are available in all areas, I had some things I could do. Perhaps I could consider driving further for a better appointment, or I could use telehealth to access geographic areas better suited to treat my disease. I started to see healthcare as a set of possible tools, but more importantly, myself as a tool wielder. From this place of power, I could change my health outcomes. What tool was available? What tool could I use in the absence of a not yet obtainable tool? Healthcare providers? We can be tools as well. Now, the tools, they were all merely suggestions. I got to decide what to use from those that were offered. This was a powerful mindset shift. The suggestion I was given by one healthcare provider that one chronic disease puts me at risk of another, not something I choose to carry around daily, but a new, faster-acting insulin sample that is something I chose to add when it was offered. I had the control, and I could say yes or no thank you. And so do you. You have the control. So why is knowing that control lies in the individual's hands so important? Because the rates of chronic disease in the United States is rising steadily, and it's projected to continue to rise rapidly, creating an even bigger strain on the current system. In addition, most adults over 65 years old have at least one chronic condition, and our national life expectancy is greater than 65. So that means my story will not be unique, and many more will face their own cross in the road, fall victim to a failing system, or learn to wield the tools in a way that best serves each and every one of us individually. And it's not just chronic diseases. Let's take a look at cancer patients. Those with an improved mindset about their disease survivability and quality of life achieved better survivability and quality of life, even when we corrected for other socioeconomic factors like access, money, and education level. Mindset, it really is that powerful. When you are in control, you start to control things that even seem out of control, like cancer. Advocacy, it's the last key to a more successful health journey. When you create a mindset that you are powerful and you use the tools available, you look for more ways to be powerful and you seek additional tools. You speak up. I'm well entrenched in healthcare. I know plenty of medical professionals, but the true pivot in my journey was when I started to align with others with type 1. When I shared my struggles and my wins, so did they. And we were able to forge a way forward together. Community, it's what leads to best outcomes. Now, you may not have the best doctor, or the most potent meds, or even timely access to appointments, but all you need is one person in your corner. Perhaps you have a sympathetic friend, an outgoing family member, or even a thoughtful stranger. Talk about your challenges and rally those that will champion your cause. The healthcare system, it's not a magic wand. It's a complex web of policies, insurance plans, and institutions. But when there are enough of us, individuals, creating change in our own lives, we will start to shift the system. And from there, it's only a matter of time before the system will adapt and start to fix itself. Dr. Doug Melton, he's a Harvard-trained scientist who has a goal to cure diabetes. He's a father of 2. His son, Sam, was diagnosed with type 1 at just 6 months of age. He has stated he knew nothing about type 1 until that moment. Dr. Melton was quoted as saying, "I had been studying the development of frogs and decided to shift focus to finding a cure for diabetes." When asked about switching his research completely, he followed up with, "Yes, it's what any parent would do. When something happens to your child, you try to fix it." And he's done just that for one man in Ohio, Brian Shelton, who participated in a clinical trial by Vertex Pharmaceuticals, where he received an infusion of stem cells grown to resemble the insulin-producing cells of the pancreas. Brian, a lifelong diabetic, after being insulin-free for 90 days, stated he felt like he got his life back. But you don't have to be a Harvard brain scientist or have a SAM to come up with big ideas. There might just be something that you or a loved one would like to navigate better in your own health. And in that sense, you too can be like Dr. Melton. You can decide today to shift gears, to abandon an old habit or thought. And in that sense, you might just come up with your own sort of cure. So if there's one thing you remember when you leave here today, it's that in your life, you call the shots. Your journey through health is just that. It's your journey. Your feelings are yours alone to create and to feel. You get to breathe life into your thoughts. And from those powerful thoughts come tools that heal and a community of like-minded individuals that say we are all worthy of maximizing our health. That is the true revolution in U.S. healthcare, to have each and every one of us know that we hold the keys, the opportunity to take the wheel, that one of us doing so makes it possible for more to do so. And that's a chain reaction that can lead to true reform.